At the 3-month visit, we're going to talk about development, sleeping, and the oral phase. In terms of development, very exciting things are happening. The baby's moving past that fussy phase where they're cranky more of the time, and they're moving more into a happy period where they're starting to coo and smile reflexively and responsively to you, and they're starting to become much more interactive in their environment. At the 2-month visit, we discussed sleep, but at the 3-month visit, we want to talk about any fine-tuning that might need to occur, whether you decided to do sleep training or whether you have decided to pursue another philosophy.
And I would say that 9 out of 10 parents probably decide to do it. And when those parents come back at the 3-month visit, I would say that 9 out of 10 parents are beaming, happy, saying how much it has changed their life and how happy they have to have babies sleeping through the night.
If it's not going so well, or if you haven't started it yet, go for it, because your window to do the sleep training is now to 6 months of age. After 6 months of age, then they get very set in their ways. Of course, sometimes it might be going well at first, and then there might be some drawbacks, like with growth spurts, or if they have a little stuffy nose or cold, or after a vaccine. They might be sleeping well for a few days, and then all of a sudden it changes, they start waking up.
So my advice is, when sleep training has worked, to make sure that you keep it going, and when the baby wakes up here and there for a disruption, to not be so quick in going into the room and restarting a cycle where you would be up every 2 hours.
So the best thing to do is stick with the original plan and be consistent and persistent.
We're going to see the hands softening and, starting to put their hands in their mouth and self-soothing. This is usually misconstrued as teething, but it's actually a beautiful phase for the babies. It's the oral phase.
Generally, teething begins between 6 to 10 months of age.
I have seen babies teeth at 3 months, but it's certainly not common. At this point, they're really doing more to explore what is right in front of them, their hands, and this is just the beginning of their exploration into the outer world.